If there is anything this coronavirus outbreak has taught us in this country, it is the importance of communication, crisis communication. Now, whilst we get Mbagathi health facility ready, get the counties all set, ensure we have the capacity to test for the virus locally, the one area this crisis has exposed is our crisis communication. That is to say, how we communicate during a crisis. From Kenyans in Wuhan claiming that there was inadequate communication at the start of this, to Kenya's ambassador to China asking the country to pray, to her rather frightening video appearance, and then to this point now with the relevant cabinet secretaries. Communication itself has been a crisis. You see, it took more than a month for us to hear from the health ministry on this. The most comprehensive statement came just last week, close to 2 months after this global outbreak. And even then, we heard not from the PS or the acting CS at the time, but from the Chief Administrative Secretary. A qualified doctor, no doubt, but the stakes in this global crisis are so high that perhaps even the president himself would have addressed the nation right from the onset to give us all the assurance we still need to date. Further, the tone of the officials has been defensive at best and convincing at worst. The CAS saying that the isolation center may be ready in about a month or so. By this time, Kenyans were already beside themselves with anxiety, worry and concern. The students in Wuhan had already expressed their displeasure at how they were being treated. Their families here had already started to make petitions to the government, and the general public had been left to their own devices. Fake news was already spreading on WhatsApp and other social media at the speed of light. But finally, the president broke his long silence. But it was not an address to the nation. Rather, through an executive order, nearly 2 months later, he appointed a National Emergency Response Committee on the coronavirus outbreak. In the order, the president overruled the CAS and directed the new team to get the isolation ward ready in 7 days instead of 30. And yet, as detailed as the executive order was, it made no mention of the Kenyans in Wuhan, even if to just reassure them that their government is doing all in its ability to keep them safe. And this was then followed by the Foreign Affairs Minister's appearance before Parliament in what the representatives termed as, quote, unconvincing, she herself saying she didn't know what else to tell them. By this time, a new CS for Health had been sworn in. The handover ceremony was another brittle affair. You see, when asked about whether they would effect the court order to get the 239 passengers off the flight from China into mandatory quarantine, the incoming CS said they did not need a court order to do their jobs. Yet, they did in fact need a court order because they had adamantly insisted on self-quarantine despite public outcry, forcing the LSK and 2 doctors to go to court on this. In addition, what we have heard from various government entities is warnings against spreading fake news and worse, xenophobia. These warnings may have been unnecessary if the government had filled the void with the right information in a clear, concise, timely and empathetic manner. Don't tell people to desist from spreading fake news. Give them the real news. And for God's sakes, why allow the recording of an announcement confirming a supposed outbreak only to say that it was part of a so-called simulation after it leaks? Folks, what I'm trying to say is that communication is very important, more so in times of crisis. How you communicate, who communicates, the content and tone of the communication, the timing and the clarity of the message. Good communication dispels fears and calms a nation. But it also shows you respect those you are mandated to serve and that you empathize with them. And that is my take tonight.